Hi friends, welcome back to Shared TV. Today we are talking about a common sleeping disorder. This is for your general knowledge. Before move on, please don't forget to subscribe us. Sleep apnea is a sleep disorder in which breathing repeatedly stops and starts during sleep. This can happen hundreds of times a night, often for a minute or longer. There are three primary types of sleep apnea. 1. Obstructive sleep apnea, OSA. This is the most common form of apnea and is caused by a physical blockage of the airway, usually when the soft tissue in the rear of the throat collapses and closes during sleep. 2. Central sleep apnea, CSA. This form is less common and is not caused by a physical blockage but rather a failure of the brain to signal the muscles to breathe. This happens because the brain doesn't send the correct signals to the muscles that control breathing. 3. Complex sleep apnea syndrome, or treatment-emergent central sleep apnea, also known as mixed sleep apnea. This type is a combination of OSA and CSA. It's generally observed in some patients who have OSA and begin CPAP therapy, only to discover CSA events persist. Symptoms of sleep apnea include loud snoring, episodes in which you stop breathing during sleep, which would be reported by another person, gasping for air during sleep, awakening with a dry mouth, morning headache, difficulty staying asleep, insomnia, excessive daytime sleepiness, hypersomnia, difficulty paying attention while awake, irritability. It's worth noting that not everyone who snores has sleep apnea, and not everyone who has sleep apnea snores. Untreated sleep apnea can lead to several complications, including cardiovascular problems, daytime fatigue, high blood pressure, type 2 diabetes, metabolic syndrome, complications with medications and surgery, liver problems, and sleep-deprived partners. Diagnosis and treatment. If sleep apnea is suspected, a sleep study, polysomnography, is typically ordered. This can be done at a sleep center or sometimes at home using a home sleep apnea test. Treatment can vary based on the type of sleep apnea and its severity. Common treatments for OSA include continuous positive airway pressure, CPAP, machines, dental appliances, lifestyle changes, like weight loss and positional therapy, and in more severe cases, surgery. Central sleep apnea treatments may involve addressing the underlying condition, using a device to assist breathing, or using medications. If you or someone you know suspects they have sleep apnea, it is essential to see a physician, as untreated sleep apnea can lead to a range of health problems. Sleeping position is important if you have sleep apnea. The sleeping position can have a significant impact on sleep apnea, especially obstructive sleep apnea. Back sleeping, supine position. Sleeping on your back can cause your tongue and soft palate to collapse to the back of your throat, which can partially obstruct your airway. This is why many people with OSA experience worsening of symptoms in this position. Side sleeping, lateral position. This is often considered the best position for people with sleep apnea. Side sleeping helps to keep the airways open and is especially beneficial for those with obstructive sleep apnea. There are two side sleeping positions. Left side sleeping. This position is considered optimal for reducing acid reflux and for circulation, but there is no significant difference between left or right side sleeping for sleep apnea. Right side sleeping. This position is also good for reducing sleep apnea symptoms but can sometimes worsen acid reflux. Stomach sleeping, prone position. This position is not recommended for people with sleep apnea as it can put a strain on the neck and spine and doesn't help in keeping the airways open. It's worth noting that while side sleeping can help reduce the symptoms of sleep apnea, it is not a substitute for professional medical treatment. If you suspect you have sleep apnea, it is important to seek a diagnosis and appropriate treatment from a healthcare professional. Treatment options may include lifestyle changes, using a CPAP machine, oral appliances, medications, or in severe cases, surgery. CPAP is one of the common solutions. CPAP stands for continuous positive airway pressure. It is a type of therapy commonly used for people with sleep disorders, such as sleep apnea, where the airways become blocked or collapse during sleep. CPAP therapy involves a machine that delivers a steady stream of air through a mask or a nosepiece to help keep your airways open while you sleep. The constant flow of air works as a sort of splint to keep the airways open, preventing apneas, pauses in breathing, and hypopneas, shallow breathing. Using a CPAP machine can help to improve sleep quality, decrease daytime sleepiness, and can also have benefits for other health issues like hypertension and cardiovascular disease, which are often associated with sleep apnea. It's important to note that it can take some time to get used to sleeping with a CPAP machine, and there are various types of masks and machines available, so it might take some trial and error to find what works best for you. Regular cleaning and maintenance of the equipment are also necessary to ensure it works correctly and to maintain hygiene. Thank you for watching. Please don't forget to subscribe us.